Hello, everyone. I'm Dr. Carmen Pugliafito, and today I'm with Dr. Michael Lai of Washington, D.C., the Retina Group of Washington. Michael is also a, an assistant clinical professor of ophthalmology at the Georgetown University School of Medicine. Mike, welcome to Retina Synthesis.
Carmen, thank you for having me. It's a pleasure to be here.
So, the title of this episode is going to be The Dilemma of Good Days. And can you provide some context about the history of Good Days and its role in retina practice in the United States?
Absolutely. Good Days is a national nonprofit charitable organization that's been around for over 20 years. It operates as an independent 501c3 organization. And in fact, in order to do so, it needs to meet all the standards and regulations governing the healthcare industry and has been deemed fully compliant by the Office of Inspector General. Good Days provides financial assistance to Medicare and Medicare Advantage patients to offset their co-insurance costs.
Uh, and how was it funded?
Typically, Good Days, like all uh, nonprofit charitable organizations, are dependent on donations. And historically, the greatest source of funding and donations come from pharmaceutical companies.
And what's changed to create the dilemma?
What's changed is that at the end of 2024, the funding for Good Days was depleted. And this uh, was created because um, the largest donor uh, cut back, or some of the largest donors to Good Days cut back on their contributions to this foundation.
What was
And
the, yeah, excuse me,
sure,
go.
well, I was going to add that in fact that funding remains inadequate even at this point in time in 2025.
What was the scope of the budget for Good Days?
Sure, we only have the most recent data we have, I believe, is from 2023 or so. And ballpark, uh, for the program that supports retinal diseases, the total budget for that year is around $400 million.
Mhm. Does Good Days do other medical specialties?
They do. They do other specialties, but the fund that we're talking about uh, is specifically earmarked for retinal diseases.
So explain what the need for the contributions to the care of Medicare and Medicare Advantage patients and what the scope of the financial burden for patients.
That's right. So Medicare, so for those who are not familiar with how government-sponsored healthcare programs work in the United States, Medicare is the largest healthcare, federally funded healthcare program in this country. Medicare covers 80% of all the costs of, of doctor's visits. And in this case, pertaining to our discussion, 80% of the cost of the injectable drugs in, in the retina space. Now, to make up for that other 20%, a patient could have a secondary or supplemental insurance. But some patients in this country don't have such a secondary or supplemental insurance. In addition, increasingly, there are more and more patients enrolled in so-called Medicare Advantage uh, insurance plans. These are insurance plans that are actually run by private insurers. They get money from the federal government to essentially manage a pool of Medicare patients. And in order to do so, many of these plans um, don't fully cover the cost of care, particularly expensive medical treatments like retinal injections.
Uh, but is it typical for a Medicare Advantage patient to buy supplemental insurance?
It is typical, but there's enough who don't. Uh, and even with supplemental insurance, there are still, depending on the plan, the policy, many patients still have a copay or a deductible.
And what's the range of the copay that we're talking about in terms of dollars?
I don't know the specific dollar. Um, but as we talked about earlier, on an annual basis, this fund distributes, more than $400 million
Hmm.
to support patients for their retinal treatments.
Hmm. So at the American Society of Retina Specialists meeting in Long Beach, California, just a few weeks ago, you presented the results of a survey of retina specialists in the United States to assess the impact of this funding decline on retinal practice. Can you let us know what that study showed?
Sure, of course. So this study was conducted by the Health Economics Committee of ASRS. We were interested in studying the impact of Good Days underfunding. So we distributed an electronic survey in April of this year, and a total of 455 US-based ASRS members completed this survey. We found that based on the response, 94% of the respondents reported that the Good Days underfunding had either a significant or moderate impact on their clinical practice. And 78% of the respondents said that at least a quarter of their Medicare age patients are unable to receive their preferred therapy because of this underfunding.
Um, and the survey inquire as to how they were dealing with the shortfall?
That's right. Yeah. So in terms of coping mechanisms, the most common strategies our respondents reported were switch the patient to repackaged bevacizumab or Avastin, provide a manufacturer sample, skip or postpone an injection, or continue the unlabeled drug therapy, but collect 20% copay from the patient.
Mm-hmm. Any sense of how many thousands of treatments per year were involved with Good Days at its peak?
We so separately conducted a study using the Vestrum electronic health database. Now, that is not the entire US patient population. That's just from 340 retina practices um, uh, in a number of private practices. But just that subset alone, when we looked at eligible patients or injection numbers to study, we found more than 280,000 injections. So I would imagine, the number for the entire country would be significantly greater.
So this is a huge issue.
Exactly.
Um, any thoughts on how things will go forward?
Well, that's a great question, Carmen. I mean, those coping mechanisms I talked about earlier, um, as retina specialists, you and I both know none of those are sustainable long term. We can't skip or postpone injections on a regular basis. We can't keep giving samples. We can't keep going to the patient and collect 20%. I mean, the whole reason why they're on copay assistance in the first place is because they have a financial need. And we also know that over the last several years, the number of compounding pharmacies that produce Avastin has decreased significantly. So the Avastin supply chain has become very fragile and unstable in this country. In fact, in our survey, almost half of the respondents told us that they're unable to obtain Avastin in reliable quantity and in sufficient quantity. So I honestly, I don't know where this is going because the cycle we're in is unsustainable. The funding needs to be restored one way or another, just because none of these coping mechanisms can be sustained long term. Yeah.
This is indeed a dilemma or indeed a crisis.
I agree. And, our motivation for conducting this study is, of course, A, to assess the extent of the impact, and B, to make our members, our industry partners, and the general public, and the policymakers aware of the harm this underfunding has caused. Obviously, our study doesn't go into solutions, but my hope is that that just by getting all this data out there and having a conversation like the one we're having now will inspire smart people out there to step up and come up with a solution.
Yeah. Well, Mike, thanks so much for your time and for your work in bringing this issue to the fore. Very important.
Well, thank you for having me. And I hope, again, conversations like this will help eventually move us to a solution. So thank you for having me, Carmen.